If you watched my previous video, then you know that diastasis recti is a common condition for women who have given birth, but it's not exclusive to pregnancy. In fact, diastasis can affect anyone, man, woman, or child, at any time. If you haven't had a chance to watch the full video yet, I'll be sure to leave a link in the description below where you can watch that, or you can click right here, because what we talk about in that first video is really going to lay the foundation for what we're going to discuss today, which is how to fix your diastasis without doing a single exercise. So be sure to subscribe and then go back and watch that video and then come back here and watch this one. Alrighty, so in the last video we talked about how diastasis recti is the unnatural separation of the two halves of your rectus abdominis caused by excessive pressure within your abdomen. We also talked about how that excessive pressure can come from something like a growing baby, as in the case of pregnancy, but can also come from increased pressure due to visceral fat, or as the result from misapplied pressure doing normal everyday activities. And in this case, it's not the activities themselves, like walking and standing, sitting, twisting, squatting, you get the idea, that cause the unnatural separation, but it's the rate at which we perform these normal activities or how frequently we're doing them under the wrong conditions. So perhaps maybe our tissues, our muscles, and our tendons and our ligaments aren't strong enough to sustain the pressure caused by these normal activities. That weakened tissue can come from poor nutrition. It can also come from not getting the right kind of stress on your muscles and ligaments and tendons so that they are strong enough to support these normal everyday activities. And again, if this isn't making sense to you, be sure you go back and watch that first video, because I really explain a lot of this in detail in that first video. Now, our bodies are designed to move in various planes of motion, such as flexing or like bending, like flexing your trunk, twisting, laterally flexing, like to bend and pick something up. But that doesn't mean that your tissues are strong enough to support those movements. When a condition like diastasis is first diagnosed, a physical therapist or a medical doctor may prescribe that you do certain corrective exercises so many times a week, so many sets, so many reps for X amount of weeks, but few people actually follow through with the prescription. They either never start or they don't complete the prescription as prescribed for the full duration of the recommended time that they were supposed to do those exercises. And even if you're in the 1% of people who actually does do the exercises and you do it for the full 6 to 8 weeks or 12 weeks or whatever it is, most people will discontinue those corrective exercises as soon as their physical therapy has ended. But here's the deal. Just because you can perform a movement that looks like what you're trying to do doesn't mean that you are performing that movement correctly, nor does it mean that you have learned how to move your body correctly. And what I mean by that is that anybody can drop it like it's hot and do a squat or perform a movement that looks like a squat. But that doesn't mean that all the right muscles are firing. A proper squat is going to recruit adequate core engagement as well as engagement from the entire musculature of the hip complex. That includes the glute medius, the glute minimus, as well as the glute maximus. So just because a movement that you do looks right doesn't mean that it is right. And even if you do perform a movement and you are able to get the correct muscular engagement in those movements in the 6 to 8 weeks or however long physical therapy is, does not mean that you have learned how to move throughout your everyday life. Learning carries with it the idea of knowing something to the point of mastery. It's being able to do something without having to consciously think of it. And in this case, we're talking about muscle memory. So I took ballet for over 12 years, almost 13 years growing up. I enrolled when I was in kindergarten, and one of the very first lessons that they taught us on day one that I still remember is that in ballet, as soon as your foot leaves the floor for any reason at all, you are to point your toes. This lesson was beginning to be taught to us at day one, but it took years to apply this lesson. Learning to point my toes every time my feet came off the ground began as a conscious effort, but after years of regular practice, it became an automatic habit because I had developed muscle memory. And I love this quote. I don't even know who said it, otherwise I would credit them for it, but I love this quote that says, "The chains of habit are too weak to be felt until they are too strong to be broken." What we're really looking to do is to develop new habits in the way that we move our body through muscle memory. You see, I haven't taken a classical ballet class in over a decade, but whenever I do a bar fitness class, I still point my toes on cue because I remember how to do that. The reason why doing corrective exercises for just 6 to 8 or 12 weeks and then discontinuing them after physical therapy fails to actually resolve the issue that you're trying to fix, like in this case we're talking about DR or diastasis, is because often the moves are done incorrectly. You're not engaging the proper muscles, you're just performing a movement that looks correct but is not actually physiologically correct. Or the exercises are not practiced correctly long enough to develop muscle memory so that you can perform it in everyday life. You can think of it this way too. If you only spend 10 minutes a day doing corrective exercises, but you move throughout the rest of your day, still giving your body the wrong input, you're still moving incorrectly throughout your day, you're still sending your body the wrong signal 83-ish% of the time, and only giving your body the correct inputs or the right signals about 17-ish% of the time. So instead of emphasizing corrective exercises for just 10 minutes a day or whatever, and that has its place, but instead of focusing on corrective exercises that you do for about 10 minutes a day, I really want to help you understand how to move correctly throughout your day. What you'll find is that by implementing the correct movement patterns for the two non-exercise correctives that I'm going to teach you in this video, the better that you are able to perform these throughout the day, the more they will reinforce any other corrective exercises that you choose to do. You'll actually have to do less corrective exercises because you'll be moving correctly throughout your day. And we're going to start by learning two of the most foundational movements that you do all day, every single day: standing and breathing. Now, I know that this probably sounds very basic and possibly even unimportant, but stick with me because every movement that you do, whether it be walking, squatting, lunging, bending, twisting, anything, is going to come from a neutral standing position. And proper breathing is integral to proper core engagement. How your body is positioned relative to gravity is going to challenge your abdomen in different and dynamic ways, which is good. But if the connection between your muscles is compromised, as in the case with diastasis, where your muscles are literally separated, then you run the risk of doing more damage to your core rather than rehabilitating it, which is obviously our goal. Now, before we get started, it's important to know that your feet are the foundation to your core. And it's best to practice finding your neutral standing stance without shoes on, because any amount of heel that you wear affects the forces applied to your knees and to your hips, which affects the alignment of your pelvis, which you may recall is one of the primary attachment points for your linea alba. You may also want to consider trying to do this exercise in front of a mirror. So in order to find your neutral standing stance, begin by standing with your feet hip width apart. Now, hip width apart means lining up the middle of your ankle with the bony prominence in your hip, which is also called the ASIS, or the anterior superior iliac spine. Most people just call it their hip bone, but now you know the technical term for it. This neutral position of your legs better distributes the weight of your body over both legs and sets you up to use the entire musculature of your hips once you begin walking. Next, you're going to back up your hips. For most of us, if we were to line a plumb line up from our hip bone, it would fall directly down to the center of our foot, when it should fall directly in line from our hip to our knee down to our ankle. When we stand with our weight shifted forward, we increase tension in our hip flexors, compress our low spine, and of particular interest to our video today, it actually increases load on our linea alba. Now, you may find it difficult to stand with your weight shifted back in your heels like this at first, but the more you do it, the more gluteal and hamstring strength you will develop, which will be able to better support you with your weight back in your heels as it should be. Another common malalignment that a lot of people have is called duck walking, which is the result of excessive lateral rotation from the hip. As a former ballerina, I used to always walk with my feet turned out. But remember, this lateral rotation of the hips affects our pelvis alignment, which affects how our linea alba receives pressure. So to find the natural alignment of your femur or your thigh bone, begin by standing with your feet pointing straight ahead so that your ankle bone, which the technical term for it is your lateral malleoli, is in line with the bony prominence just behind your pinky toe. Now, it's important to note that the rotation that takes place here comes from your hip. It doesn't come from your ankle and it doesn't come from your knee. The rotation needs to come from your hips. Now, the amount of rotation that you need to achieve neutral will depend on how much rotation was taking place in the first place, and it's also important to note that each leg might be slightly different. Working our way up the body, let's look at our pelvis. In order to find neutral pelvic alignment, we need to locate 3 bony landmarks: the ASIS of each of your hips, and also the pubic symphysis. We've already identified the ASIS, so your pubic symphysis is the joint that connects your 2 hip bones, or your iliacasis. together. It's the lowest bony prominence of your pelvis before it wraps into your undercarriage. After locating these 3 bony landmarks, you'll want to arrange both your AS, IS, and your pubic symphysis vertically. You may find different muscles tensing as you try to find that neutral alignment, but if you find yourself straining, take that as feedback from your body that certain tissues are tight and need to be lengthened. A key to achieving neutral body alignment is to lengthen the muscles that are tight and strengthen the muscles that are weak. And as you begin to move correctly, it's important to find a healthy workout routine that promotes comprehensive functional movement pattern. I'll leave a link in the description box below where you can stream my favorite functional movement programs right from your living room. After you've loosened the muscles that are tight, you should find that your body naturally falls into neutral alignment. The next structure that we're going to look at to achieve proper neutral alignment is the rib cage, which is the second primary attachment point to our linea alba. And this may be the hardest structure to align. And that's because where the ribs go, the linea alba follows. Remember, we talked about how our bodies are capable of various dynamic movements, and so what may have caused the unnatural separation of your rectus abdominis is the rate at which you perform natural everyday movements, or the weakened condition of your muscles, ligaments, and tendons, which makes them unable to support your body during those normal everyday activities. Because of the cubicle monkey lifestyle that so many of us live, the muscles of our shoulders and our chest have been conditioned to being stuck in this hunched up and rounded position. And even if you don't have a desk job, like I'm a stay-at-home mom, but constantly holding my children and nursing, I still get this hunched up and rounded position. You get that when you're driving. So just about all of us have what is referred to as forward head posture. And while it may look like we've corrected the issue simply by lifting our chest and pulling our shoulders back, really all we've done in most cases is compound the issue, because now we've lifted our rib cage. We haven't actually fixed any of the structural problems. Our shoulders are still rounded. We've just lifted our rib cage with it, which has added more stress on our linea alba. So in order to find the neutral alignment of our rib cage, we need to drop our ribs, and we need to do that by bringing the rib cage down, backwards, and together. It's that last part of bringing the rib cage together that may be the most difficult, because in order to do that, we need to activate our transverse thoracic, and we'll do that by implementing our next non-exercise corrective, which will help with our breathing. Do you remember the 3 balloons that we talked about in the previous video, how they were sandwiched together? The balloons that represented our abdominal cavity, our thoracic cavity, and our pelvic floor cavity? Well, we're going to talk about them again now. In order to breathe, you have to drop the pressure in your thoracic balloon cavity. We do that by increasing the volume or making our cavity bigger. You can make our thoracic cavity balloon bigger 3 ways, and that's by dropping your diaphragm, flaring your ribs out, or elevating your shoulders. You can do any combination of the 3, but in most cases, the musculature of our ribs and our arms are stiff and unused, and our diaphragm is locked in the up position. So I hate to tell you, but that abdomen that you're trying to hold in, you need to let it out. That's how you're going to drop that diaphragm down. Now, to activate your transverse thoracic and your other accessory breathing muscles like your intercostals, put a resistance loop around your torso, just under your chest muscles. Ladies, this is right where our broad line is. Gentlemen, that's going to be where you might place a heart rate monitor. You can practice this exercise seated or standing, and as you get familiar with the feeling of the 360 breath and your ribcage expanding and coming back together, you can actually ditch the loop, and you'll be able to practice this all day as you go about your normal business. But for now, whether seated or standing with that band around your torso, take a big deep breath, expanding your rib cage until you feel your ribs press into the band. On the exhale, take note as how it feels as your ribs pull away from the band and closer to an imaginary pull that's running up the center of your body. With each exhale, you should feel the muscles of your abdomen and your intercostals engage. Because many of us have developed shallow breathing habits by holding in our stomachs and our diaphragms are stuck in that up position, don't be surprised that as you drop your diaphragm and practice this 360 breathing, if it actually feels a little hard to breathe at first. Changing our pattern of breathing can really mess with you, so the most important thing is to keep breathing, and if it becomes too difficult, return to the breathing pattern that feels comfortable for you and maybe circle around and come back to this part. So there you guys have it. I hope this video was very helpful for you in learning just 2 basic ways that you can start learning how to move better throughout your entire day without exercising to help correct your diastasis. Now, I do want to say that this video is for educational and entertainment purposes only. It is not medical advice, and if you do have questions about any kind of condition, then it is best to seek out professional advice from your medical provider. If you found value in this video, please be sure to like and subscribe and hit that notification bell so that you'll be notified every time I upload a new video.